So that's the AGD disclaimer. These are AGD approved courses. And so this one's a little different. A lot of times you go to these meetings and because we're concerned about the biological impact of the materials, we take something away from you. Oh, well, you can't use that, and you can't use this. And you got to do that away. So a lot of people end up feeling like they've lost something in the process of going to a meeting. So what I'm going to do is I'm going to first slap you upside the head and take something away, and then I'm going to give you a lot more back, because this is really not a program of taking things away. It's about improving the care that we give, and that there are things that work a lot better than what we've had in the past. Who thinks it's wise to drill a big hole in a tooth? I mean, not a good way to do it. How about using a xenobiotic to reduce tooth decay? If the kid swallows, they'll die. So this is not the way to go. I was recently invited to present some of the information at the City Council for Valparaiso, and they were considering whether to continue adding silica fluoride to the public water supply. And those are just exercises that I do because they're kind of fun to do, sort of like fighting with a bully. So I decided, instead of giving a lecture about he said, she said, because if I say this, then they say that. If I say this, then they say that. So I decided that my new tack is going to be what they say, and got their attention, because I'm not going to use my normal fluoride talk. I'm going to use what the advocates for fluoridation say, and that we'll basically walk you through that to begin with, and then we'll show you two other things. One, how to stop gum disease and tooth decay in its tracks. I wrote a book, you saw back in '94, about how to save your teeth with toxic-free preventive dentistry. It went through 2 printings, the publisher died, and so I have a PDF of it I'm glad to send anybody. And it really lays out the case that we had 20 years ago for non-use of toxic materials, and how to stop tooth decay, how to stop gum disease. It's really simple. And what this is a fundamental course. So what I'm going to summarize for you today are basically what we've learned from the scientists over the last 30 years. And that I'm counting it up in my head the other day. We've had 14 toxicologists, published scientists, experts, not dentists, public experts in fluoride talk to our academy over the years. We've had 20 times that many in mercury, and that in periodontal disease and infected root canals and stuff like that, I think we've had almost a dozen. So I'm going to talk about the things that we know, but I'm going to start off with what is settled science. And so let's go to what the American Dental Association says about infant formula. And after, you see the date on this is November 9th, and that the reason that is significant is that the National Academies of Science spoke in July of 2006. And so this was their holy smokes moment when they said, oh, well, we can't continue to advocate that babies be exposed to fluoride in the baby bottle, because at the alleged optimum level, the baby is dosed at a level that's well above the amount that causes dental fluorosis. And that it's interesting that their focus was on dental fluorosis, because that's the only disease that exposure to fluoride causes that is within the purview of a dentist to diagnose and treat. And treat we do. We got laminates, we got bleaching, we've got microabrasion. So it's lucrative. It's a good thing. But if you use liquid concentrate or powdered formula to make up the formula, then you're going to overdose the baby. Why did they limit it to those two? What if you buy the ready-to-feed formula? In 1979, gee, that's older than the Academy. The FDA made the formula manufacturers move the processing plant out of fluoridated communities or use fluoride-free water. So ready-to-feed formula is fluoride-free liquid. The trouble is soy also has a pesticide residue in it, so you get some fluoride from the pesticide residue in the soy formulas. But if you use milk formula, you don't. It's because milk doesn't have formula. So that was published in the Journal of the American Dental Association and Levi first reported that in 1995, and so and this e-gram went out to the members dentists, 11 years later. So anyway, they're saying don't feed the baby formula. And so does fluoride work to reduce tooth decay if it's swallowed? And my dental school back in the 60s said, oh yeah, you got to swallow it. It gets in your blood, goes around and gets up in the tooth and makes the tooth solid from the inside. And that wasn't true. There's lots of things we learned in dental school that simply were not true, and that's one of them, because published in the Journal of the American Dental Association, and again on the CDC's website in 2001 and the ADA Journal in 2000, says that the only measurable effects are topical. Topical, like sunblock. You don't have to swallow sunblock to keep from getting a sunburn. And so that's what they say. And they also say that the amount of tooth decay in the population is not related to the concentration of fluoride in the enamel. And more is not better. And so, gee, can I get my money back for my education? I think I paid a few dollars for that. Not as much as the kids today. Woohoo! I just look at that. Put the money in real estate. Anyway, so the anti-caries effect is post-operative and post-eruptive and topical. So it means the tooth's got to be in the mouth. So there's no reason to give a baby that doesn't have any teeth this stuff. And actually, there's no reason to give a baby this stuff anyway. Even when the outer layers of the enamel are high, 1,000 parts per million. How do you get to 1,000 parts per million? You're going to the dentist and getting topical at 15,000 parts per million to get your enamel up to 1,000. Crest toothpaste is 1,000 parts per million, FYI. Colgate's 1,500. But, that doesn't make any difference. It doesn't make any difference how much fluoride you have in your enamel. The enamel is just as easy to rot with a lot of fluoride in it as it is without much fluoride in it. And it's easier to rot if it's got dental fluorosis. So, gee, what song have we heard for the last 60 years? Fluoride, 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 fluoride's good for you. Wonder if we're talking to retarded people here. Can we speak it English here? Let's say the fluoride incorporated developmentally. That means you swallowed it, and it circulated around your blood and came back out in your tooth into the normal tooth mineral. Is insufficient to have a measurable effect on acid solubility, which is what tooth decay is. So let's face it, the majority of the scientific community now have agreed that the effects are entirely topical. And that's not surprising. If I invented an arsenic toothpaste, arsenic is bad for stuff. And so if you brushed your teeth with a bunch of that, and it would be bad for the germs that happen to be living there. The trouble is, germs and you and I are very much alike. I've got a degree in biochemistry. How did we learn how the human body worked? We studied how bacteria work. And what we found out was how they work is exactly how we work. So if you inhibit the bacteria one way, what makes you any different? Well, you're bigger. Oh, okay. But so what? That's not what you want to do. You want to make that bacteria die. And so that's a different program. I once made the mistake of saying the reason that fluoride works is because it kills the germs. And an old guy who's made a living promoting fluoridation for years and years had to jump on me and say, oh, no, it's not lethal to the bacteria. And so it just makes them sick. Okay. So that's why they have the warning on the toothpaste, is it keep out of reach of children. And if the amount used in brush, use a pea-sized amount or half a pea-sized amount. Supervise the child to make sure that they don't swallow it. And if the amount used in brushing is swallowed, then contact the Poison Control Center immediately. That warning went on the toothpaste in 1979. And the reason it went on the toothpaste in 1979 is the Poison Control Centers were reporting on average, and Poison Control Centers only exist in half the states, so in 25 states out of the 50. Poison Control Centers were reporting on average about 10,000 contacts a year with parents of children who were made ill by swallowed toothpaste. And so they were constantly after the FDA, you need to do something about this because, parents are not supervising the children and not keeping them from swallowing the toothpaste. And I remember driving home from Newport, Rhode Island with my friend Dick Darnell, and he was brushing his teeth in the car. We'd driven all night, and he was swallowing the toothpaste. And I said, this is 1969. I said, I don't think you're supposed to swallow the toothpaste. And he said, I get the systemic benefit, too. So he'd been listening in class, you see. So it inhibits the germs that might cause tooth decay. Well, yeah, but that's also the same reason that the teeth end up spotted, because it inhibited the enzyme that was removing the protein and putting in calcium hydroxyapatite. So the inhibition effect of fluoride is universal. It is the most studied element on the planet, I think, and it inhibits every enzyme they've ever studied, including those that don't have a metallic cofactor. A lot of enzymes work with a little bit of metal as a catalyst. Fluoride inhibits them all, and it does it by unwinding proteins. It does it by breaking hydrogen bonds. It's what's called a xenobiotic. It's not a nutrient. It's a deadly poison. And so it inhibits the ability of the bacteria to breathe because it inhibits the cycle inside the bacteria where the bacteria can generate energy. And so just like fluoride inhibits the cells in a child's body, making bone and making teeth as well and making brain, it's due to an inhibition of this enzyme, which is called matrix metalloproteinase 20. And I never heard of MMP20 until Pam Dembeston did her research and said it's the inhibition of that enzyme that's causing the funny looking spotted teeth. And so if you got Wikipedia or something like that, you can go look up MMP20, and it's well known that this is a very important enzyme in the human body. It has to do with all normal physiological processes such as the development of an embryo, reproduction, tissue remodeling, as well as disease processes such as arthritis and cancer metastasis. Most MMP20s are secreted as inactive proteins, which are activated and when cleaved by extracellular proteinase. So when you inhibit that, you end up with funny-looking spotted teeth. Well, if you grind up the kid, you got funny-looking spotted brain, funny-looking spotted bone, funny-looking spotted arteries. It's not wise to go around inhibiting normal biological processes, even if it did reduce tooth decay a little tiny bit, and I don't believe it does at all. I think it's a total fake program, but that's me. So the question is, second, is fluoride safe for the baby? And no, it is not. And then I recommend that you do the math, and that you can watch me do the math for you on this little YouTube thing. Fluoridation advocate admits poisoning babies. And Howard Pollack is the millionaire lobbyist, is a Mr. Dentist. He's a bachelor of dentistry, went to dental school 2 years in England, couldn't be licensed in the United States, so he goes around promoting fluoridation. And he's been paid $500,000 twice by the state of California to do dental surveys that are so crummy, unblinded surveys that could not get published. So he even hired his wife to help him with it. So it's making money for him. So when you want to know why they're out there promoting it, it's because they're making money at it. And so you got to question, why are we paying these people to lie to us? So I'll help you with the math. If you take $1 and divide it into 4 pieces, what do you get? I think I heard somebody a quarter. And if you wrote that out, that would be 0.25, right? Well, dentists are so poorly trained, most of them don't know the difference between a concentration, like 1 part per million, and a dose, which is always weight for weight. So a concentration is an amount per volume. A dose is weight for weight. And so the dose of fluoride, a baby, say a 4-kilogram baby drinking a liter of 1 part per million water a day in formula, the dose that baby would get would be 4 divided into 1, and you get 0.25. So the dose baby gets is 0.25 milligrams per kilogram, because there's a milligram in a liter, 0.25 milligrams per kilogram. That's good. Okay, great, really. So the EPA's reference dose for fluoride is 0.06. So 6 cents worth of the stuff will poison a baby, and we're giving it a quarter. So if you were doing that with lead or arsenic or anything else, the Child Protective Service would take the kid away from you. So this idiot has given this baby 4 times more of this terrible poison than we know will harm him. Might explain a lot about society today, do you think? And here's what the formula is for prescription fluoride. And we're in the process. One of our lawyers in the academy has done a lot of research on this, and that you can get fluoride by prescription. Did you know that the prescription fluoride is not FDA approved? There are no new drug applications on file. The FDA rejected one application for vitamins with fluoride, saying there was no evidence of benefit, and it's still, you can buy this stuff at every pharmacy in every drugstore in the United States. So here we have a non-FDA approved product that's recommended by dentists and physicians, pediatricians all over. Schools dispense these. So we have a drug that's a deadly poison that's not FDA approved. The FDA has actually said it doesn't work, and you can get it. So how much should you give a baby? Let's see. It says 0. So regardless of the amount of fluoride in the water, it says 0. And this is from the people that are recommending that we put it in the water. So how do you get 0 into the baby? Well, Howard Pollack, the $1 million lobbyist, says the baby should be breastfed. Great. You just go ahead and take the next 6 months or a year off from your work as a dental assistant and go home and stay home and feed the baby, because the tap water is not safe for it. So what we got to do is have you drink the tap water, circulate it around your body, and it filters it out through your breast so that the baby doesn't get any fluoride. That's kind of like an expensive filter, but that's also the best food for the baby. So anyway, since that's the dosage schedule, then I'm recommending that we get city water that would be safe for the baby to drink. And so research has shown that mother's breast milk has no fluoride in it. Where did it go? It ended up in her bones. Is that the mother's body sequesters the fluoride, either excretes it through the kidney or it parks it in your bones for a lifetime. So one of my programs, I retired from clinical practice at the turn of the century, and since then I've made numerous documentaries that are playing on public access TV. If you have a public access TV in your area, let me know. We'll sign you up as one of our producers, and you'll have 2 seasons worth of programs. One of them is called Poison Horses, and that Kathy Justice loves her horses. She doesn't have any children, and she takes care of her horses. She feeds them organic food. She grows organic foods and grinds it up and goes out and takes better care of these horses than most people take care of their children. And what she noticed was her brood mares became sick. They became sickest the quickest, she said, because in her town, Pagosa Springs, Colorado, they had started adding silico fluoride. And a horse drinks 30 gallons of water a day. If it's a brood mare, if it's nursing a foal, it'll drink 30 gallons of water a day. Just do the math. It greatly exceeds the level known to poison the horse. And so she had these horses autopsied by Cornell University professor Leonard Kruk, and proved that they were fluoride poisoned horses. Did you know? All you got to do is cut up the bone, and you can see under a microscope what fluoride did to the bone. Obviously, I have Dr. Kruk's slides. He's passed away this last year. A great man. So that's what the horse does. The horse filters out the fluoride so the foal doesn't get it. And so fluoride in tap water is responsible for a substantial percentage of dental fluorosis. They will argue, the water fluoridation program never causes any dental fluorosis. And that's nice for them to say, and you have to say, and you have a reference for that? So in the academy, we teach you to ask for the evidence. So you have some evidence of that? Well, it's recommended. Okay, well, that would be like public relations. I understand that they recommended. I'm looking for a scientific study, maybe with 39,000 children in 84 different communities throughout the United States that were randomized. And that would be the National Institute of Dental Research in 1987, that they surveyed 84 different communities, 39,000 some odd children, and they showed that if there was fluoride in the water supply, a little bit, they got 14% of the kids had dental fluorosis, and then if there's a little more, there's 20%, a little more is 29.9%, and a little more is up to 40%. So how do they say water fluoridation doesn't cause dental fluorosis? That looks like it's certainly implicated in the increase, wouldn't you think? So when this study was done, the National Institute of Dental Research, who pride themselves in promoting fluoridation, said water fluoridation reduced tooth decay tremendously throughout the United States and caused no adverse effects. But they wouldn't show you the data. And do you know what the story is? That if a scientist wants to tell you about their conclusions and they won't show you their data, do you know what the only conclusion you can arrive at is? They're lying. So John Yamianis sued them under the Freedom of Information Act, and this data they said they'd lost. It was a $11 million study. Now, if you could get Fox News to pay attention, the Center for Disease Control, the NIDR, lost an $11 million worth of data? Where is it? Did it get hidden with the emails from the IRS or something? Well, they did find the data on tooth decay. And so in 1987, this study came out and showed there was no statistically significant difference in tooth decay from any amount of fluoride in the water supply. And I think it's important that you understand the word statistically significant, because they did come up with a study that used 15% of this data, and they said it caused 22% difference. And then the question is, and was that statistically significant? What do you want to know for? Because it's not statistically significant. It's 1/2 of one tooth, and it was didn't adjust for the delay and eruption that fluoride causes. So when they say it's been proven safe and effective by thousands of studies, you just got to ask them for the study that advocate thinks is really, really good and well done and published in a peer-reviewed scientific journal where the data is available for other people to examine. And you'll find that doesn't exist. All the big studies show there's no significant difference. There's even studies from Germany where they stopped fluoridation. East Germany was made to fluoridate by the Russians. And then when East Germany and West Germany got back together, West Germany said, we don't allow fluoridation, so you've got to stop. So now they got all these studies from Germany showing that when you stop fluoridation, tooth decay goes down. So when they say, oh, if you stop fluoridation, your tooth decay go up, and they said, you should have told the Germans that. So the next question is, since everybody is supposed to be able to use the water supply, is it safe for everyone? And so we can go to the Agency for Toxic Substance Disease Registry, who said in 91, I guess, that existing data indicates that subsets of the population are unusually susceptible to the toxic effects of fluoride and its compounds. And these populations include elderly, and that's anybody over 50. People with deficiencies of calcium, magnesium, and vitamin C. That would be somebody that was malnourished, for example, or on the average American diet. And people with cardiovascular disease or kidney problems. So because fluoride is excreted through the kidney, people with renal insufficiency would have impaired renal clearance, and they're at greater risk. And so we've got 13% of the population in the United States have renal insufficiency. So already 13% of the people in the United States shouldn't be drinking the tap water in fluoridated communities. And with about 25% of the people with cardiovascular disease, and then we've got malnutrition. So we've got between 50 and 75% of the population that, according to ATSDR, shouldn't be exposed to fluoride. So let's put it in everybody's food. What do you think? Poor nutrition indicates the incidence and severity of both dental fluorosis and skeletal fluorosis. And the advocates for fluoridation are very, very proud of the fact that they claim there's no skeletal fluorosis in the United States, which is not true. Skeletal fluorosis is a continuum from a joint that a little creaky to one that's locked up. My wife and I have been to 27 countries throughout the United States. I was invited to China in 1999 to survey the areas of high natural fluoride, and that it made her cry. It's just heartrending how crippled these people become at levels that are found in many foods and vegetables and stuff in the United States, and they're not overnourished. The overnourishment tends to protect the body, especially with a high protein diet, against the toxic effects of fluoride. But they were crippled at 4 parts per million. At the time, 4 parts per million was legal in many water supplies in the United States, and still is to this day. And the National Academies of Science was asked, is that a safe level for everyone? And they answered unanimously. Can you spell unanimously? They answered unanimously that no, it is not. And then they went on to list why it was not. So anyway, malnutrition increases its toxicity. And so that's the very people that we're allegedly benefiting. So they grab your heartstring and say, we need to help the poor little children that can't afford to go to the dentist by putting this xenobiotic in the water supply. Is ingested fluoride approved by the FDA? And I mentioned that, but I didn't read you their exact statement. There is no substantial evidence of drug effectiveness as prescribed, recommended, or suggested in the labeling. And what new information is that? That would be 1975. Published in the Federal Register, and it was repeated again in a journal called Drug Therapy. New drug applications withdrawn for fluoride. So that's one of our new ideas, is that since they're after dentists and physicians for prescribing stuff like DMPS and so forth, it's not FDA approved in the United States. It is in Russia, it is in Germany, it is in other countries, not here. And it's against the Practice Acts to prescribe it. Do you think it's within the Practice Acts to prescribe fluoride? Not according to the laws of the United States. Maybe a wink and a nod from the dental board, but it's not FDA approved. So any physician writing a prescription for a product that's not FDA approved, regardless of the fact you can get it at Walmart pharmacy, is putting their own license at risk. And when I contacted Colgate, they have a product that contains fluoride for children. And years ago, I asked them, what evidence do you have that this is a good product? And they sent me a study by Peebles. And it was a terrible study, a little tiny thing. They didn't control whether the kid actually took the pills or not. And 67% of the kids that received fluoride tablets had dental fluorosis. So that's really the only conclusion, that if you took a tablet more or less, sometimes or another, you had a 67% chance of getting dental fluorosis. So is dental fluorosis expensive? I think so. So it's just as simple as 1, 2, 3. Dental benefits, if any, are topical. Everybody agrees that tap water formula is not safe for a small baby, and it's not FDA approved as safe or effective, because that's not how it works. You can't swallow a tablet and get it in your saliva to poison the little germs that happen to be hanging out there. So the question that occurs to everybody is, how come all the dentists are telling me it's a good idea? And I'll tell you why. It's because they're being lied to. And here's a perfect example. On the scientific blogging, they were saying that, the National Academies of Science said that the level in water was not safe, but they went on to say the only documented effects are from fluoride from 2 to 4. And the concentrations for community water fluoridation, the current dosage schedule for other modalities, ensure safety. Well, what's the current dosage schedule? That's 0 for a baby. So how would 0 for a baby ensure safety? So they basically talk to you like you're an idiot. Because if the current dosage schedule for a baby is 0, then the only safe level in the water would be 0, right? So and then they said the only documented health effects were 2 to 4 milligrams per liter. So they again have conflated concentration for dose. And I just showed you how to calculate dose. If you had 4 milligrams per liter, the baby would get 1 milligram per kilogram. It was a 4-kilogram baby. So the National Academies of Science review, and I have a PDF of this, and we're going to take questions at the very end. But write it down, because you'll forget if you've been around Mercury. I'm speaking from experience, you know. So the 2006 report started in 2003, and these are 12 world-class scientists and toxicologists, risk assessment experts, and that their only question was what level of fluoride in the public water supply is safe for everyone for a lifetime. And that Dr. Thiessen replied to a request, and she said that based on the known effects of fluoride, and the known effects are skeletal fluorosis, bone fractures, severe dental fluorosis, And based on those effects, that 4 parts per million was not safe, because those effects occur at 4 parts per million. And that what they did not say is that fluoride was safe. They unanimously rejected the MCLG. What's the MCLG? It's the level of fluoride in the public water supply that can be safe for everyone for a lifetime. We already heard it's bad for you if you got kidneys that are on the fritz, or a heart disease on the fritz, or you're malnourished. So they did not evaluate the safety or effectiveness of fluoridation. They were asked actually not to. And they pointed out gobs of areas that need more research. And so the other thing that they said was that the effects of fluoride on certain systems, such as the endocrine system, particularly the thyroid, can occur at levels of exposure in terms of milligrams per kilogram per day that are reached by people at fluoride concentrations drinking water at 1 to 4 milligrams per liter, especially in infants. And putting even a small amount of safety factor between the unsafe and possibly safe puts possibly safe well below community water fluoridation levels. So, as an example, and let's take that example I gave you of the baby on a bottle that's getting 25 cents worth of fluoride. So the National Academy of Science went through and they reported that if the baby was getting 5 cents worth of fluoride, that it would damage the thyroid. But if the mother was iodine deficient, or the baby was iodine deficient, that as little as a penny's worth of fluoride. So you're giving that baby 25 times more fluoride than is known to harm it. And I think that's a crime. If you went to the schoolyard with candy that had lead in it at 25 times the level that lead could be in candy, and were passing it out to the little children, I could get the police down there and arrest you for child endangerment. And so are you ready for the bad news? It's not fluoride. They don't put fluoride in the water supply. They put hydrofluorosilicic acid in the water supply. And that is a man-made molecule that is a piece of sand in the middle, and it's populated with 6 fluoride molecules, and it has hydrogen missing. So it's got a negative charge. It's an acid. It's a mild acid, but if you splashed a half a cup on you, you're going to die. So this is the wonderful elixir from the pollution scrubbers of the phosphate fertilizer mining industry. And so it is tremendously profitable to the phosphate fertilizer industries of Florida, and that's spelled with a U, China, Mexico, Japan, Belgium. So other than Florida, what is the characteristic of China, Mexico, Japan, and Belgium that they all have in common? They don't allow fluoride in their water supply. They got to get rid of it somehow, so they sell it to the Americans. We give it to our kiddies, you know. And that they will say, oh, it's all fluoride because the molecule completely dissociates once you put it in the water. We'll see if that's true. Because when you do studies looking to see if there's any impact of silicofluoridated treated water, that you find that it doubles the blood level of lead in the people receiving that water. Nobody I know thinks that's a good idea. If they happen to be Hispanic, they had a 4-fold increase in the number of children over 10 micrograms per deciliter in their blood, which used to be the threshold for lower IQ. Now they think 2 micrograms is. This is an old study from 2000. And if they were African American, they had a 6-fold decline or increase actually in blood level of lead. So they say, oh, it's not having any impact on society. Well, if it is, how come you get these numbers when you do data mining from NHANES, the National Institute of Healthy Babies? They take blood from babies and you just correlate where the baby lives versus what water treatment's given to the community, and you show that there's a direct relationship. And even more important, Dr. Masters points out, there is an ethnic difference between Caucasians, Hispanics, and African Americans. He did not have enough Asians in his study. He did not have enough North American Indians in his study. He said there may be differences there too. There are only 430,000 children in these 2 studies. 430,000 children. Well, that's 10 times more children than all the tooth decay studies ever done. Oh, that's interesting. So when you say the weight of the evidence, you got to say 430,000 weighs a lot more than 39,000. 39 didn't even show any benefit. So in Brazil, where they have some really forward-thinking dentists that are scientists, they decided to see if it was true what the advocates for fluoridation say, is that silicon fluoride, the same as just plain fluoride, and has no effect whatsoever on lead. And so they had this actually multiple rat study, but four systems. They had the control, and they had the rats that had silicon fluoride in their water supply, but no lead. They had rats that had no silicon fluoride and lead. And then the fourth column was the rats that had silicon fluoride and lead. And what they showed was a huge jump in the whole blood lead level. So if they were correct in saying that silicon fluoride completely dissociates and there was no difference between silicon fluoride and any other kind of fluoride, you would not see this effect. And yet we do. And so this was Sawan and Leite, and so they traded places, and so this one's Leite and Sawan. And so what they did is they did it another way. And so they decided to look and see, and there's a control, which is, good oral health. They flossed every day. I guess these are rats. And so then they put silicon fluoride in the water, and they looked for dental fluorosis. And they showed that when you put silicon fluoride in the water, you get dental fluorosis in a rat. And they used a lot higher levels than we do humans, and that's because I think the rat only lives to be 2 years old, and I think it was a 6-week study or something like that, or less than 6 months. So, and then this is interesting. When you put silicon fluoride and lead in the water, you get a jump in the amount of fluorosis. She's measuring dental fluorosis of the upper incisors. And silicon fluoride plus lead bumps it way up. And so silicon fluoride and lead and silicon fluoride plus lead bumps it way up. Lead alone doesn't cause dental fluorosis. But when you add lead and silicon fluoride, you get a lot more dental fluorosis. So let's go back to that Center for Disease Control and see what they found. Is that if you can get this online, or I'll send you a copy of it, it's table 23 in the Morbidity Mortality Weekly Report from August 26, 2005. And it's basically dental fluorosis surveillance of dental fluorosis in the United States. And so it reported how nice and wonderful fluoridation was, and how it's good for everybody, and there is this little table in the back. And this table in the back shows that moderate to severe dental fluorosis occurs in 3 to 5% of the black and Hispanic children. Moderate to severe is where the corners of your teeth are missing and the teeth are all brown and mottled. And then the Caucasians were about 2%. And so the advocates for fluoridation say that there is no moderate severe dental fluorosis in the United States. Well, they should tell the Center for Disease Control to remove that table, because it shows that not only is there plenty of it, is that the dental fluorosis, understand the way they're using to score this, and I would say they're cheating. Very mild, for example, is 25% of the second most severely damaged tooth. The second most severely damaged tooth? If I came up to my wife and I gave her a right cross and a left cross, and the left cross broke her jaw, and the right cross just blackened her eye, I said, she's got a black eye. It's the second most severely damaged area. Why aren't we concerned about both injuries? Because it doesn't make any sense to consider the second most severely damaged tooth. This is what they do to detoxify the damage in the minds of the people. Oh, it's just very mild. Very mild is 25% or more of your 2 front teeth. I don't want my 2 front teeth to look funny. And in California, they determined that dental fluorosis, they didn't determine severe dental fluorosis, moderate dental fluorosis, or dental fluorosis was an adverse health impact, because other children would taunt you. And you know how important your personal self-image is in California? They didn't want children to be going, Spot, you look like Spot. Children are mean midgets. W.C. Fields was right. And they will make fun of any child that looks the least bit out of the ordinary. And that when you put silicon fluoride in the water, you make 40% of the children have at least 2 teeth that look out of the ordinary, and that's today's standard. If we go back, roll the clock back to 1945, and say, okay, it's 40% now. But what was it when it started? Less than 1/2 of 1%. Oh, so this wonderful fluoridation program has increased dental fluorosis 80-fold. Or as the dentists like to talk about tooth decay, that's, what, is that 8,000%? So has it reduced tooth decay? No. Tooth decay has gone down faster in other countries than it has in this one that don't allow fluoride in their water supply. So it's like, where's the beef? Show me the data. So I have bumper stickers that I got a call from New Orleans one time. Somebody went, I got a baby. I said, well, don't put tap water in the formula. So that's what they say. And so does that sound like the kind of stuff that you want to put your name on and say, I stake my professional integrity on the fact that putting silicon fluoride from China in your water supply is good for everyone and won't harm anybody, and it's been approved by the American Dollar Association. So people ask me sometimes why I get so exercised about this, and I reply that when Betty and I went through China, that Sin Guofan gave us an interpreter who was an MD, PhD, and a master's in epidemiology. Her name was Chin Cho, and she was just the nicest person in the world. She was absolutely bent over backwards to make sure that we had food that we could recognize and comfortable place to sleep. And she packaged bottled water in the car. We were driving into an area of endemic fluorosis, so that she packaged pure water from the Waha spring in the car, so we had wonderful clean water to drink the whole way. And I thanked her when we got all done a few years later and made a documentary about it, and said I really appreciated how great a job she did. And she said, oh, but it's my duty. So that's what I tell people, is that, how come you're so exercised about fluoride? I said, because it's my duty. So now I took fluoride away. Anybody want to go home and get 15,000 parts per million and start slopping around the children's teeth? I don't think so. So let's look at what else you can do. And then to do that, I'm going to show you one of the things that the Academy has come up with to treat, reverse periodontal disease. Yes?
You were talking about fluoride in the water.
Yeah?
You weren't mentioning topical fluorides, pharmaceutical grade topical. What the difference would be.
I know. And your point is?
Well, there's fluoride in saliva.
The fluoride in saliva is about the same as human breast milk. The only way you can get elevated fluoride in the saliva is to brush with a fluoride toothpaste. That one of the people that spoke to our academy years ago was Dr. Phyllis Mullinax at Harvard. And so in many dental offices, they apply what they call topical fluoride treatment. And so Harvard had done a study in the children's clinic where they actually did venipunctures on the children that were receiving a topical fluoride treatment. And what they showed was that the blood level of fluoride went up during the topical fluoride treatment, and that's because the mouth absorbs fluoride. And so Phyllis thought, well, I'll see what that blood level of fluoride does in rats. And so in pregnant rats, dams I think they're called, during the 3rd trimester of rat pregnancy, she gave them a single bolus dose of fluoride to create exactly the same level of fluoride in the blood that humans have. Now, understandably, a rat system is extremely vigorous. You can take a rat, cut it all over with a razor blade, and throw it in the sewer, and it'll run around and give you the high sign and run off and have more babies and not get infected. And that's because its liver pumps out huge amounts of vitamin C, and it can fight off infection much better than we can. And it also, every human being on the planet would die if you gave it 5 milligrams per kilogram fluoride. A rat, you can kill half of them if you give it between 100 and 120 milligrams per kilogram. So if you look at a minimum, a rat is 20 to 50-fold more resistant to fluoride than humans. So she had to give the rat more fluoride to get the blood level up to identical levels that you would experience if you were in a dental chair as a pregnant lady having a topical fluoride treatment. and produced permanently hyperactive rats. That a single burst of fluoride during the 3rd trimester of pregnancy produced rats that were brain damaged, and it was not reversible. That the rats were permanently, they would groom half themselves, they would bite the bars on the cage, they would bite the other rats, they were just totally antisocial rats, just very bad behavior. She did the experiment another way, and she exposed the rats after they were born, and they became little couch potato rats. And they just sat around like this, didn't do much. So there were 2 different effects depending on the timing of the fluoride exposure. So that in dental offices they use sodium fluoride, sodium monofluorophosphate, and other compounds that when you use them topically in a dental office, you elevate the blood level of fluoride. And that these effects that I'm showing you are because of systemic exposure. So with the mouth, ability to absorb fluoride from any source, toothpaste, topical fluoride treatment, dental fillings, dental cements, sealants, varnishes, there is no such thing as putting something topically inside the mouth. It's a form of insanity to think that you could. And as I said earlier, that I was going to give you something back, because it's not even a particularly good way to stop tooth decay. Tooth decay is an infection. Is that if you don't have a test that's in your office called caries check, get it. It's real simple. You spit in the tube, incubate it for 2 days, and if it turns purple, the kid's got a bug in his mouth called Streptococcus mutans. And so then, once you know that tooth decay is an infection that goes from person to person, usually mother to child. You know how you can blame your mother? Here's another one. Mom! Mothers, lovers, and siblings are where the tooth decay germs come from. And so kids share a spoon with mom. So almost all the bugs in your body are your mother's at one point in time. And so if you want to change that, you need to alter that process. And you don't alter it by making the bug sick. So that is the insanity of fluoride, is that it doesn't kill them. It just makes them sick. And as soon as the saliva level drops back down to something that would be what God intended, physiological normal, 0.00001, the germs go back into making tooth decay. Well, why don't you think about it a little bit and say, gee, if there's a bug in there that I don't like, I need to figure out what makes it die. And what makes strep mutans die? Do you know? I know. Study by Lopez in Puerto Rico, where we're going. Was she a dentist? No, she's a pediatrician. She's tired of the children coming in with all the rotted teeth. Think about it. If you had a child in your practice that was going to bed every night with a baby bottle with milk and a tablespoon of sugar, and warmed up very nicely so it slides down the little baby's stomach, do you think that baby's teeth might rot? Well, Dr. Lopez saw child after child after child, week after week after week, month after month after month, year after year after year with rotted teeth. Baby bottle tooth decay is what they used to call it when I was in school. And she got tired of that, so she decided to do an experiment, like any good doctor. And so she dabbed these children's teeth with 4 different substances: distilled water, fluoride that was made from tea at 4 parts per million, which was the maximum level of fluoride you can have in public water supply in the United States and Puerto Rico, and povidone iodine. And the povidone iodine it's the orange stuff that the doctor paints on your hand. If you get a cut, they paint you with povidone iodine. It's iodine that has an ammonia molecule hooked to it. And ammonia looks like protein. Bacteria eat by swallowing or absorbing protein. So when you put iodine with an ammonia group on one end, it's like a gift wrap hand grenade with the pin missing. So the bacteria absorb it and the iodine kills it. So you can kill the germs on your skin by painting it with a little bit of iodine. So Dr. Lopez thought maybe she would paint the children's teeth. Well, These are 1-year-old babies. They look like rabbits, the 2 teeth on the top and 2 teeth on the bottom. And she's a busy lady. She can't spend a lot of time doing topical fluoride treatment and polishing the teeth with rubber cups and stuff like that. So what she did, she had the nurse open up one of these little packages of iodine. When the mother brought the kid in, they went dab, dab on the 2 front teeth and see you in 2 months. So 6 times in a 12-month period, and had a 50% decline in the anticipated tooth decay. And that's from doing it 6 times in a year. The fluoride was no different than the distilled water. And they didn't use a high level of fluoride because it's not approved and it's also not safe for a baby. So all of a sudden she gave us a tool that works better. And so in the biocompatible mode, you'd say, oh, povidone iodine, that doesn't quit killing ever because it's an antiseptic. So what other form of iodines are there? Well, iodine is a mineral. It's a natural mineral. It's essential. If you don't have iodine, you get fibrocystic breast disease, you have breast cancers, you have thyroid suppression. It's an extremely important trace mineral. And it's essential for every cell in the human body. So what form is the nutrient form? Well, that would be Lugol's. What is Lugol's? Lugol's is 50-50 iodine and iodide. It's half free of a molecule, the other with another molecule attached to it. So it's iodine and iodide. Lugol's, available on the internet, or you can order it from the pharmaceutical company by the gallon. And so your dental office treatment then morphs from measure the strep mutans, put the child in the chair, treat them with topical iodine with a saliva ejector inside there so the kid doesn't swallow it, and rubber cup, mix it with the pumice and put it in the rubber cup and scrub it all around the teeth. So you rub the iodine around, you kill all the little strep mutans. You put it in a water pick and squirt it around and kill all the little strep mutans guys that live in there. Have the kid come back in a month and spit in a tube. Does it still turn purple? It won't. Not if you did a good job. If it does, do it again. Do it again until that tube doesn't turn purple. You know what? That kid will quit getting cavities. Because tooth decay is an infection. And so rather than just make the bug sick, kill them and measure it. Kill them and measure it. It's just that simple. What do you do when you go to the sink? You smear your hands all over with something that inhibits bacteria, you rub them with soap and wash them down the drain. It's just as, like Semmelweis told us 1,000,000 years ago, it's hygiene. And that's not a girl. Let's see. Looking for my next. No, you don't want to know about that. You want to know all about that. Open recent. There we are. In the fundamentals folder, of course. Everybody should look at that. So, do we need to take a break? Yes, no? Bathroom break? Let's make it short, and then we'll come back. And what I'm going to do is put this back together for you. I'm going to give you tools that are going to work for you in your practice, make money for you, and make you a better dentist.